Sickle cell disease affects an estimated 70,000 to 100,000 Americans.
I was diagnosed with sickle cell when I believe I was 3 months old.
The disease occurs in 1 in every 500 African American births. Sickle cell is an inherited blood disorder that affects your red blood cells.
My parents found that at birth.
It takes both parents to get sickle cell disease.
Her first attack, when she was a baby, she cried so much, she got me so nervous. Mommy said, told me to get her dressed. We were taking her to the hospital.
The sickle cells also block the flow of blood through the vessels.
It'd be days I can't walk, or my arms hurt too bad you can't move. Your back hurts you when you stand up. You gotta sit down just for a little while.
Causing lung tissue damage, pain episodes, stroke, priapism, spleen, kidney, and liver damage. There are 4 different types of sickle cell disease. You can also have sickle cell trait. Sickle cell trait is not the disease, but you carry 1 gene for sickle hemoglobin and 1 for normal hemoglobin. Sickle cell trait does not have the same complications as the disease. Treatment of sickle cell disease includes antibiotics, pain management, intravenous fluids, blood transfusion, surgery, and psychosocial support.
My parents never let the doctors over-medicate me.
A lot of kids get addicted to that medicine. And it's, morphine is very strong.
Hydroxyurea is another major key in the treatment for sickle cell disease. The drug can prevent red blood cells from sickling. Research shows it reduced the frequency of severe pain and acute chest syndrome and the need for blood transfusions. Children as young as 2 years old are now taking the drug. The use of hydroxyurea in children and adults was first reported in the National Belgium Survey according to a Medscape report. The report goes on to say, I quote, hydroxyurea is a drug that has been used for many years for the treatment of slow-growing types of cancer, end of quote. Hydroxyurea is not a cure for sickle cell disease, according to the report in Medscape, but it did say the drug has been proven to reduce the number of hospitalizations and medical complications in half. Global Medical News caught up with Dr. Zora Rogers from the University of Texas Southwestern Medical Center, and here's what she had to say about hydroxyurea and pediatric health.
We think this has changed the way we will treat sickle cell disease in the developed world. We do not need to reserve hydroxyurea any longer for those who are most severely involved. We can begin it at a young age, prevent problems, and we hope in continued follow-up to be able to demonstrate preventing organ damage with the early initiation of hydroxyurea. What we are suggesting is that as young as 1 year of age, children with sickle cell anemia and their families discuss with their doctors the use of hydroxyurea. The ongoing follow-up data shows that you don't have to reserve it for having problems.
Through this project, I hope to prove that hydroxyurea should be recommended for all sickle cell patients, not just some with severe pain. And maybe in the future, we can have less crisis and people suffering with sickle cell disease will be able to live longer, healthier lives.
Right?